University of Michigan Health Community Conversations. Today, we will be addressing the hesitancy around the COVID-19 vaccine. As our community continues to fight against the COVID-19 pandemic and recognizes the hundreds of thousands of lives lost to it, 2 vaccines have emerged and are already distributed to many Americans. Despite the dangers the COVID-19 virus poses to our communities, there is still mistrust concerning the vaccines and its development. While this mistrust intersects amongst all cultural lines, it presents significantly in the Black, African American, and Latinx communities. Metro Health acknowledges that there is undisputable historical context for this mistrust and hesitancy regarding the COVID-19 vaccine. So the purpose of this community conversation is to present empirical data regarding the spread of this virus, its disproportionate impact on Black and African American communities, as well as provide information on the clinical trials in the development of the 2 COVID-19 vaccines. Additionally, the panel that we have for you today will provide information on Metro Health's strategic rollout within the communities impacted hardest by this virus. Most importantly, this event is meant to be a conversation amongst Metro Health staff, coworker to coworker, and our community. Metro Health staff and community members who are joining us live today, we're going to ask that we encourage you to submit your questions so that we can answer them during today's event. Let me introduce our panelists to you today. We have Monica Taylor, who is the COO of the Metro Health Medical Group. We have Dr. Del DeHart, who is an infectious disease and internal medicine physician. We have Dr. Antonia Henry, the Associate Chief Clinical Officer and colorectal surgeon. We have Dr. Rayanne Booker, who is the Vice President of Diversity, Equity, and Inclusion. And myself, I'm Tanya Moyer. I'm the Director of Performance Improvement here at Metro Health, and I will be your moderator for today. So we're going to get started with Dr. DeHart. Can you share the background on the spread of this virus and its disproportionate impact on the Black and African American communities?
I'd be happy to do that best I can. We learned early on when the pandemic started in early March and April, it seemed to affect communities of color, and particularly urban areas were hardest hit. And there were times when Black, African American, or Hispanic people were 5 to 7 times more likely to just simply be infected by the numbers. And when they were infected, they were more likely to die. There were lots of reasons what we thought might be true for that. Sometimes there were situations where people were living in multi-generational families, so there may have been more exposure. Living in an urban area where people are closer together certainly is part of the reason. It's harder to say for sure whether being Black or Hispanic is more of a risk to actually get the virus, but that may possibly be true as well. So early on, it was terribly impactful for communities of color.
Can you discuss the COVID-19 clinical trials and the diversity of the trial participants? There have been some questions surrounding that.
Certainly, and that's a great question to talk about. So early on, when it was recognized that a vaccine might be possible, we anticipated that there would be concerns. First of all, would it work in every ethnic group? Didn't know that for sure, you can assume it. And then also, if we were going to bring a vaccine forward quickly, we needed to be able to tell people that it had been tested in their group of people, among people like them. So, for instance, the vaccine we've started with here at Metro and are rolling out more widely was the Pfizer vaccine. And 18 to 20% of people in the initial trial, and that was thousands of people, were people of color, were non-white. And then the Moderna vaccine, which is becoming more widely available now, that was even higher. It was well over 20% of people in the trials were people of color. So from the very beginning, there was a real effort to be sure that the trials were inclusive, and we didn't assume that it was going to be safe for everyone. And thus far, it has been. There's been no difference in how people respond to the vaccine and any other side effects or long-term problems from it based on race or ethnicity.
That's good to hear. There have been other questions about the expedited timeliness of the rollout of this vaccine. Can you speak to that and the safety of it?
Certainly. So it is, you hear the word unprecedented all the time, and it is unprecedented, but I know our particular professional organization, the Infectious Disease Society, from very early on, we were advocating that we cannot cut safety corners on this. We have to do this correctly, because the worst thing could have happened would have been we bring something too quickly to the market, and then we find out it's hurting people. You know, the outcome of that for this disease and for any vaccination would have just been hard to fathom with concern around vaccines that people do have. So critically important that it was safe. So the reason this moved forward so quickly is companies and governments were willing to fund getting ready to manufacture the vaccine. So if the trials worked, the vaccine would be available. So that's a risk. You spend millions of dollars getting ready to manufacture it, and it wasn't safe, you just throw it away. So that's why once we knew the trials looked good, 95% effective and safe, that we were ready to have millions of doses of vaccine ready to go.
Thank you. That's helpful to hear that funding was a factor. I actually did not know that. Mm-hmm. So let's move to Dr. Henry. Can you speak to the historical trauma in regards to BIPOC individuals and the clinical trials and the vaccine development?
Yes, absolutely. Thank you. So the increased hesitancy.
If you could hit your, thank you.
Oh, sorry. It's been particularly disheartening to see that African American and Hispanic Americans are less likely to say that they would receive the vaccine if offered, especially given our increased incidence rates and mortality in our communities. And this is in the context of a legacy of structural racism in American medicine. The Tuskegee experiment through the U.S. Public Health Service is the most emblematic of the interactions that African Americans have had with institutionalized medicine. And if you're not aware, it was an observational experiment where African American men, many of them sharecroppers, so the most vulnerable of the vulnerable, were allowed to be untreated for syphilis while they were observed when effective treatment existed. But this is just one example in a long history dating back to slavery. Other examples include horrific surgical experiments on enslaved Black women by gynecologists, which paved the way for modern surgery, but at the expense of surgeries without anesthesia on women without their consent. All of this is in our historical memory, and it's also colored by current interactions that Black and brown people have with healthcare. And we see that in under prescription of pain medication for Black and brown patients with similar disease states as non-people of color, and in the underdiagnosed and undertreatment of cardiovascular disease in women and Black Americans. So this COVID is happening in our lived experience and contributes to vaccine hesitancy right now. And it's going to take a lot of effort at relationship building, trust building, to overcome this hundreds of years long of a negative legacy of our interactions with the medical system.
So thank you for sharing with us this generational trauma that is spanned across and what we're seeing right now, today. Monica, as the COVID-19 vaccine rollout expands to more of our community, it will be important that Metro strategically focuses some of its community-based vaccine sites in the communities that have been heavily impacted by the virus. What is Metro's plan to do this?
That's a great question. Our plan right now is that, we've got one hospital-based clinic right now that's really open to all that are in the open tiers. What we have further done, so right now the open tiers include healthcare workers. Metro Health has assigned various schools, K through 12 teachers, administrators, law enforcement. But we are focusing on our Metro Health patients, patients that are established with us and have been for the last 2 years or have a future appointment. And they are have to be age 65 and older, and that's in the state's criteria. Now, what we have further done is we have developed really an acuity listing that's really helping us to look at, again, those are established patients. And what we've looked at is we've stratified it by patients that have the highest risk of COVID complications, at risk for hospital admission or readmission. And then we further took that list and looked at it across race, ethnicity, insurance status, insurance data. And really the very interesting thing that we found was, prior to stratifying that, if you looked at the race and ethnicity columns, it looked very different than when we filtered by that data. So now with that list filtered by race, ethnicity, insurance data, there is a team that is reaching out to those patients, and we are encouraging them. We're answering any questions that they have, but we're offering them the opportunity to schedule to get the vaccine. So that's what's happening today. And again, the rate limiter is always the vaccine availability. So we do have plans to continue to roll this out to other locations, to our primary care locations. Our community clinic will also be probably one of the first that we'll expand that out to, and I know that team is working to get that rollout underway. But in addition to at our primary care sites, the community clinic, an additional site on the other side of town, we are going to, we're equipping right now the ABC bus. We have a grant that was approved by the foundation, and so we're purchasing what's called a care pod. And so we are going to take that care pod, the ABC bus, out to these various communities. And so again, we're going to work to ensure that we're reaching our patients, those communities that we serve, where they are, as opposed to having them come to us. In our more medicinal settings, we're going to reach out to them, whether that's community centers, churches, whatever seems to make sense, as we partner with, our various organizations. But we're going to take these efforts to the patients where they need them.
Nice. Can you share the timeline on the ABC bus or other items that you have set up for the community clinics?
I think the ABC bus, we're probably still a few weeks from actually rolling that out, just because some of the logistics and things that we're finalizing. But I think the care pod is probably still a couple of months out. That had to be ordered. And then as that comes in, we've got a few things that we need to do just to make sure that it's ready. But all of the planning is occurring now so that we can make sure where do we need to go. We're trying to get the data. So, it helps us to determine, the populations, the communities of where we really need to go as we take the ABC bus, the care pod, and take our services on the road.
Okay, good to know. Thank you.
Yes.
So, Dr. Booker, can you share with us about your observations or your experiences in the rollout of the vaccine?
Okay, yeah, I'm so excited to be a part of the rollout and seeing and helping to inform the intentionality around ensuring we are reaching all communities and that we are understanding the differences that we may bring in our understanding of COVID-19, the vaccine, our understanding of the clinical trials, and our understanding of the benefits and risks of the vaccine for us as individuals and groups and communities. It's been interesting to be at tables, and I think like across a lot of industries, we start sometimes with this idea of one box or one approach fits all, so that, okay, here's the solution and everyone get in line. But we learn very quickly that we can walk through life experiencing things and having outcomes very, very differently. And so it's been good to be at the tables and to have at Metro Health and other healthcare organizations taking the time to really parse the data, to better understand the different groups that are in our communities, better understand their needs, better understand the resources of our communities, because I believe one of the solutions to this will certainly be working across organizations. So we don't have all the answers at Metro Health. We will need to partner with others. And so it's great that we're having conversations like this internally, but that also we're sitting at the tables with other community organizations, understanding their needs, the resources they bring, and then coming alongside them. I think also as it relates to just the rollout of this, it's very exciting to know that at Metro Health that we have a plan to bring the resources to the community. So everyone doesn't necessarily have access to the hospital or physician's office, or may not feel comfortable. And in my own experience with my father, who was not sold on the vaccine, it made a huge difference in his consideration in that one of the vaccine clinic locations was in a church, or is in a church. And so the fact that as healthcare organizations, we're identifying community resources where there may be a greater level of trust and comfort for individuals, that's critical to this work. And I'm glad that Metro is approaching it in that way.
Thank you for sharing that. That makes sense. So as I mentioned, this is a live event, and so we have quite a few questions that are coming through, and I want to make sure we give an opportunity for our panel to be able to field some of these questions. So the first one is for Dr. DeHart. How long is the vaccine effective, and still a person who has a vaccine? Okay, how long is the vaccine effective? Let's say that.
Oh, okay. So the honest answer to that is we don't know for sure, but we're learning. We expect that it will probably be effective for at least 6 months to a year, and it may be a lot longer than that. We're still learning how long you're immune if you get the virus itself, right? So those things we're learning in real time, but I think a practical answer would be probably at least a year or so it will be effective, and maybe longer.
Will we need to receive another dose or regular doses like we do with the flu shot?
And again, that's one that we really don't know for sure. One thing about the COVID virus, it doesn't change as rapidly as flu does. And the viruses are just completely different in that flu, we know the way it reproduces and the way it goes, it's designed to change every year. COVID is not like that, but any virus is going to slowly change a little bit over time. And so it seems right now the virus strains that we're hearing about that are newer probably are still going to be the vaccine's probably still going to be protective.
Okay.
So it's possible in a year or two we may need to revaccinate. We'll learn that as we go along. It's possible that we'll need a booster that's slightly tweaked so it's more effective for newer strains that might come out.
So can a person who has had the vaccine contract or pass COVID?
Yes. So we know right now that the two vaccines that we have are about 95% effective. And primarily that means you're just not going to get it or get sick almost 95% of the time compared to you not having the vaccine. It is still possible that people can get the virus and you get it in your mouth and your nose, but not get sick with it, not know that you're very sick. And it's possible that someone who does that could pass it along to someone else. But the risk is hugely lower. So it's theoretically possible. We don't really know how often that's going to happen. But because of that, that's why we still talk about we should wear masks and continue all the other things we can do, because vaccine will be just part of getting the pandemic down, both in our community and around the world.
So we have a question for the panel. Have you all had the vaccine, and how did you come to the decision to receive the vaccine? Anyone?
Yes, I did get the vaccine. Coming from a military background, I've been given so many injections over my lifetime that I am not afraid of vaccines, but that's my personal experience. It's just one example of how a person's previous interactions with the medical system can inform their choice about whether or not to get this vaccine. I had several hours of aches and pains and feeling a little bit tired, but I got over it and feeling well.
I am fully vaccinated. Really, my personal journey to this, it was really just, trying to educate myself, talking to, friends, colleagues, even my physician friends, just kind of querying them as well. I think for me, it was also more personal. I have an 8-year-old who's, as many of us, who have children, he's had to quarantine a couple of times because of exposure. And, watching him go through that, I made him get tested. And I said, I don't want to have him keep going through this and others do the same. And so that also was very, just a personal decision for me that, I needed to do my part to help protect him. And again, as we were, educating each other along the way, that was really a very strong piece for me in wanting to make sure, that I did my part to keep him safe and then to keep others safe as well.
Excuse me. So I too had the vaccination, and I can say that it was not a quick nor easy decision for me. I really resonated with a lot of the history that Dr. Henry shared, and just had hesitancy about the vaccine, and so had lots of conversations, did lots of research, was very intentional about the sources. So who did I go to or what sources did I go to in order to better understand this vaccine? Because we know that there's a lot of different information out there. And so I wanted to learn from the experts and to access trusted sources, resources. And so my husband and I, we had a long discussion about this, because for us, it wasn't just a decision for us as a husband and wife. It felt like more of a family decision, not even just husband, wife, and kids, but it felt more like a decision that was reflective of our family and our even broader community. And we also knew that as individuals, especially coming from a community where there is more hesitancy about this vaccine, that our decision would also impact the decision of others, especially others who look like us. And if we were leading people down a path related to this vaccine, we wanted to be sure that we felt comfortable with it. So we did. We made the decision to get the vaccine, and actually I posted it on Facebook. And I typically don't share a lot. I kind of like to fly under the radar, make a big impact, but fly under the radar. But I felt like it was very important to be visible, especially for the Black community. And I'm going to share with you what I put on my Facebook post that helped inform my decision. And then as a person of faith, that also helped inform my decision. The way we came to this decision and what I put on my Facebook is, first we sought God's direction, so we prayed about it. We learned from the experts, and we made an informed decision. And then lastly, I think for us, and I think this is a critical step for everyone, and we're continuing to do this, demonstrated respect for people whose decision may be different from our own. So we decided to get the vaccine. We felt informed. We trusted the science behind it. We were also walking alongside family and friends who don't feel the same, and who are still to this day saying, how did you do that? I shared that, I posted that statement on my Facebook post, and I got mixed responses from people. A lot of people saying, way to go, and a lot of people saying, I don't understand that. So you have to walk alongside people, meet them where they are.
Absolutely.
And help inform others and respect their decisions.
Well, I can guess what the chief director of infectious diseases did, but we'll let you go.
Well, because it was a new vaccine, I certainly read about it very carefully and read the clinical trials and had the chance to do that. I think for me, one of the things, I had a chance to work with Dr. Booker, and we went to a couple of different groups in our hospital that we recognize might be people that come from communities that would be unsure, in order to just talk about that. And as you mentioned, Dr. Booker, I think a lot of it is relationship. There's so much information out there, and some of it is misinformation. So finding the right people to ask, people that you trust, and that's what we hope to bring to that, is that, yes, I did get the vaccine, did very well, no real problem with it, and did that for myself, but also for my patients, for my family, at-risk people in my family, had people in the hospital from my family. So it is not only just a personal decision, but it's a community decision, as you said, for us.
So I have heard this question a few times. Does the vaccine cause infertility or miscarriage?
No, but I want to mention one thing. Pregnant women were not included in the initial trials. And just as people of color have not oftentimes been included in these kind of medical decision making and medical development, that's been true for pregnant women across the board for forever. And so the American College of Gynecology, the physician group of OB and gynecology doctors, did come out and say they recommended that women would be able to get the vaccine. They strongly consider it and considered it safe. So first of all, millions of people have been vaccinated so far. So we know a lot more about safety than we did even from the trial. And pregnant women are getting the vaccine and thus far doing very well. So that's all we know right now, but there's no theoretical reason why it would do anything like that.
Okay, that's good to know. So what can the vaccine providers do to help the community make an informed decision as to whether or not they should get the vaccine? That's directed to you, Dr. Henry.
So going back to, what we've been talking about, building trust with communities, I think it's going to take an effort to go to religious leaders, to churches, to community organizations, to advocacy groups, and engage their leadership in educating the public about the risk and the benefits, and using them to propagate the correct information out to the communities to get their buy-in. But I think it has to start with that engagement of the community leaders first to build trust.
Thank you. Another question for Dr. DeHart. When does Metro think the vaccine will roll out to more of the general public?
Tanya, you may be able to help me as well, Monica,
Monica.
because you've been involved in these discussions. So like every organization, we don't know from week to week exactly how much vaccine will be available, because the state is working to look at all the factors that Monica described to make sure the vaccine's rolling out equitably and in areas where the vaccine needs to be used for communities at highest risk. So we are planning right now, and we've already rolled out to a number of people in the community that state and CDC guidelines tell us are the next tiers. So all I can say is that I know we and other organizations in the community, we're trying to stay ahead of it. So when vaccine is available, the phrase we use is get the shots in the arm. We don't want us to be the reason why people aren't getting the vaccine. When we have it, we want to get it into people within a few days.
And just to, continue to support what Dr. DeHart is saying, and for us, it's really about the preparation. Our rate limiter right now is just the availability of the vaccine. It is a week-to-week effort. Lori Price, Pete Haverkamp, there's a team, that's meeting frequently. And again, that's where, we have the discussions. What did we get? What appointments, how many appointments can we open up week to week? And if we don't get enough vaccine, We're not able to open up as many appointments as we'd like. We're trying to make sure that, people who have had their first dose get their second dose. So it's a lot of discussion and preparation. But again, to Dr. DeHart's point, we want to make sure that we're ready. So when, Pete and Lori say, okay, we've got thousands and thousands of doses that'll be here next week, we have the rollout plan together. We know where we'd like to go out in the community to our NOC sites, all of that. So that's a lot of the preparatory work that we're trying to make sure so that we are ready when we get the call that we've got much more vaccine on the way.
Okay, thank you. So this is a great question for our panel because I don't know how to answer this one. Do you have recommendations on how to approach conversations with family members? How do I encourage them to get the vaccine? My husband, I didn't write this question, but I need the answer to this one. My husband and I have both had both rounds of the vaccine, but within our family, we're about 50-50. And those conversations, what should they look like to encourage our family members to receive the vaccine? Anyone can.
I would definitely not encourage you to coerce people. So we can't force people. So we don't want to use coercion here. But I do think within families that we have to, and I said this earlier, that we can be, at different stages. We could be on one extreme within the same family. I'm running to the vaccine because I trust the process. I'm okay with this. And you can be on that other extreme where I don't want to hear about it. Maybe you're somewhere we're in the middle. So you have to meet people where they are. I think there's also an expectation that we have of family members and even beyond that you need to make a decision right now because there is an urgency around this. There really is. It's very serious what's happening around us. So we know the importance of the vaccine for us, but we're looking for people to make a decision right now. And some groups don't make decisions, or individuals make decisions that quickly. It takes a little longer. There needs to be a little more evidence. There needs to be a longer thought process around this. So my encouragement is to, again, making sure that we are making information available. And if you're looking for information, here at Metro, we have information that we could share with you. I'm sure other healthcare organizations have it also. So making sure you're looking at accurate information, tapping into a number of resources. If you need to speak with someone, I would say call your area healthcare organizations and community organizations that can help facilitate conversations. So my recommendation is to continue helping to inform their decision, but also know that you may have to walk alongside someone till they're able to make that decision for themselves.
Mm-hmm. That's good.
So I've tried to break down barriers by asking people, why are you reluctant? What's keeping you? A lot of friends and family members wanted to not be the first in line. Like they did these studies and thousands of people, will let 1 million people get vaccinated before I get in line. Well, that's happening. And so I tried to say, okay, well, millions of people are getting vaccinated. There's no data saying that it's that people are dying or still getting COVID. Like, it's actually very good evidence that it's very safe. I mean, it's not perfect. There's never going to be a perfect data, but just trying to confront their misgivings. I also use myself as an example, like myself and my sister, who's an emergency medicine physician. We both got it. We're fine. You should consider it. It seems safe. And also just by confronting patients with family members with the extreme changes that have taken place in our lives since last February and March. Clearly not doing anything and just continuing to try to social distance and wear your mask and do the things because there's fatigue with all of those measures. I say to you, you're a proactive person. You do other things in your life to kind of address challenges. What else do we have right now that's going to turn the tide in this pandemic? And just consider that. If you ever want to get back to normal, not wear a mask get back to your life, there aren't a lot of options. And so I try not to be really preachy about it, but I just, here are the facts.
Right. So great tips. So does everyone need to be vaccinated in order for this virus to go away?
Well, again, the answer there is no. How quickly the virus will go away is really dependent primarily on how many people get infected and how many people they infect. And so for every person who gets the virus, if they give it to 2 other people, then that becomes a pandemic. That just multiplies. If they, on average, give it to less than 1 person, so some people get it and don't pass it on, some people do, then the pandemic is going to go away. So people, 40, I'll give you the real number, almost 50,000 people in Kent County have had the virus already. We're getting there, more people have been vaccinated in the country than have had the virus so far. So all those factors, combined with social distancing for now, mask wearing, is going to bring that number down. I don't think anybody believes this virus is going to go away, but it will become much more manageable as people are vaccinated. We're all hopeful within a month to a year, this is going to become a very manageable thing. And as Dr. Henry said, life is going to look a lot more normal.
Mm-hmm. While we have you, can you speak to the side effects that we might expect once we receive the vaccination?
Certainly. So it's interesting, the word side effects, because every vaccine should have a side effect. That's what we're looking for, to try to mimic the infection so your body responds. So when people get a fever or some chills or feel tired or feel achy, you can say that's a side effect, but that's actually the intention of the vaccine. So those things I always take as a good sign if you have it, and they go away pretty quickly. They're very manageable. Most people don't have any real disruption to their life. So that's the first thing. There are some side effects that have been reported, and that would be an allergy. We set up to be very ready to handle that if that were to occur here at Metro. We have not really had any significant or life-threatening infections, and as Dr. Henry said, there have been no deaths related to the vaccine anywhere thus far. There have been some allergic anaphylactic reactions, but those are very manageable, and within a few hours, people are better and they're treated, and we're prepared to handle that, and that's true for any vaccine.
Okay, thank you. That's good to hear. What about patients on blood thinners? Is it okay to get the vaccine when on blood thinners?
Yes, there's no contraindication there.
How does the vaccine actually work, and where can I find more information on the studies?
You can find all the information on it at the CDC. The New York Times actually has a fantastic website devoted to the vaccines and the trials and everything that's been done. It's a very good site. And I'm sorry, the first part of that question was the most important.
How does the vaccine actually work?
Yep. Yeah, thank you. I'm sorry. So some vaccines are the whole virus. You try to kill the virus or inactivate it, and your body has to deal with all the mishmash of a virus, which is a complicated thing. But only a few parts of that virus can the body respond to and protect you for. So we know how this virus actually attaches to our cells. It's called a spike protein, and you can read about that. And so this vaccine helps the body to produce some of that protein. It doesn't get into the DNA. In fact, the vaccine itself is probably gone within an hour of when you get the vaccine. That's why we have to bring it to places at -70 degrees. It's so fragile. But what it does, it turns over so quickly, and it helps your body produce this protein, and then your body reacts to that. So it develops that antibody. It really kind of jumps ahead on what the normal vaccine or what the normal infection would do. Say, here's what really matters, and that's all that we're vaccinating for right now. Mm-hmm. So in theory, it's probably the safest way to approach a vaccine, to know exactly what you need and not have to develop antibodies to all the other things that don't really matter.
It's very informative. Thank you. If I don't experience any side effects, does that mean the vaccine isn't working for me?
No, it doesn't. So we know that developing antibodies is the easiest thing to measure, and people develop antibodies whether they have a reaction or not. I honestly did not have much of a reaction to the vaccine, and I kind of wish I would have a little more, but I still think it's been effective. So that varies from person to person, but you don't have to have those side effects to be protected.
So good to know. So the next question is for Monica. When more vaccines are widely available, how do I sign up to receive mine through Metro?
As a Metro employee, healthcare worker, our process that we have today is, we encourage employees to schedule through MyChart. We also have a call center that they can call. The other piece, especially as when we first opened this up, it was really just for Metro employees. And so if there are still employees that now are ready to get vaccinated, you can do either of those options. You can easily schedule an appointment in MyChart. You're welcome to call the call center, or don't hesitate, to reach out. A lot of times we're getting some supervisors that are saying, hey, I've got, this employee that, works on this shift, would like to get them set up. And we're happy to make sure, that, again, our employees again, are getting the appointments that they need for that first or second dose. Because again, we want to make sure, that, we continue to be protected so that we can better take care of our patients in the communities.
Thank you. So the next question is for Dr. Booker. I struggle with resentment towards others who don't want to be vaccinated. Given how many people have died from this virus, but I know that everyone has their personal reasons, how do I reconcile that?
Yeah. So say the question again, Tanya, the first part of the question.
I struggle with the resentment towards others who don't want to be vaccinated, given how many people have died from this virus.
Yeah. Yeah, so that can be very difficult. So this idea that, how should I feel about people who do not want to get the vaccination? And so I think that we have to really understand that we're all coming at this in some similar ways, but also in some very different ways, and that it could be a myriad of different reasons why someone would not want the vaccine, even with all the evidence that's out there that shows the benefits of it. And even with hearing from panels like this, even when you yourself may be an example for them because you've gotten it and you've shown that, okay, I got the vaccine and there weren't major effects to it for me, and you should do this. And so, again, I think, in situations like that I think things will evolve over time. So we're moving really quickly and appropriately, we're moving at a pace, wanting people to get the vaccine. Some are going to be in line and are in line right now. Others will get on board at a later time, and some may decide never to get that vaccine. And I think as an individual, it certainly would be important not to hold resentment toward those individuals, but hopefully to contribute to efforts to make sure that we are at least continuously providing information, helpful information, in ways that people can make an informed decision.
Thank you. So the next question is, how are healthcare organizations assisting patients who get the first round of the vaccine to get the second round of the vaccine? And how critical is that timing in between the doses? Do they actually have to be 21 days apart?
And I think, Monica, you probably are better to answer the first part of that about how we're doing it as an organization to be sure people get the second vaccine dose. What I would say about the importance of the timing, so we know a lot about the vaccine and how it works based on how the clinical trials were run. So that's why we're very critical about that timing because we know that'll work if we do it that way. That's the way it was tested. But we also know that probably there's some flexibility around that. So the critical thing about any vaccine is the first dose kind of primes your immune system to say, hey, there's something to pay attention to. And the second dose, given enough time for it to develop, really develops the reaction that you need to develop the antibodies and the protection. So one of the vaccines, 21 days, one is 28. Somewhere in there is probably appropriate. So somewhere in that range is the best decision, I think, but there's some flexibility around that.
Okay. And at least relative to, at least how Metro is responding to ensure that patients, employees get both doses. When you set up your first appointment, we make sure that second appointment is already set up 3 weeks later. And again, I've heard, I don't know that, if other organizations are doing the same. But again, it was important for us to make sure, just because of just the availability of the vaccine, we wanted to make sure at least what we were receiving, that we could ensure that we were able to get people their first and second doses. So we schedule both appointments at the same time. And, again, so far that's worked well. Again, we'll continue to evaluate, just the continued efforts to do that as more vaccine becomes available.
Okay, thank you. All right, so our next question is, I'm not currently a patient of Metro, but would like to get the vaccine. Do you know when you'll be opening it up for those who are not currently your patients? So that's for you, Monica.
Again, and I hate to sound like a broken record, but it's all about vaccine availability. We did make really an intentional decision early on, to make sure that, beyond our employees and then, those assigned groups to Metro, and others in some of the open tiers, law enforcement and things like that, that as we were looking at that 65 and up population, that we prioritized our Metro Health patients. And that was, a conversation that we had. Did we just open this up to anyone 65 and up, Metro or not? And, again, the conscious decision was, we really have a duty to the patients that we serve, the patients, the covered lives that we're responsible for. And so we intentionally said we are going to, at least for now, restrict this to established patients of record or patients with a future appointment. So when will we be able to open it up to patients that have patients with no affiliation to Metro? As soon as we get more vaccine. Again, I think we wanted, like Dr. DeHart said, we want to get shots in arms. And again, it's just the limiter is the vaccine availability. If we knew we had, 10,000 doses coming, that could be a game changer in how we do things. But for right now, we wanted to make sure that we're taking care of those patients who've entrusted Metro to care for them. And again, that it's been just a very critical decision point for us.
Okay, thank you.
Tanya,
Yes.
one other thing along that line is that Metro as an organization, she mentioned Pete Haberkamp, our pharmacist, we've been participating with a West Michigan coalition to ensure that all the healthcare organizations, the health departments in our region are coordinating how we roll this out. So we've made an intentional decision to be part of that so that we would be part of reaching the whole community of West Michigan and could do that in a coordinated way. So that's been one of the intentional ways that we want to be sure that we're part of reaching everyone in the community. And we meet every week and go through all that with that organization.
Great to hear. So we've been getting really great questions from the public, so thank you. If we have provided vaccines throughout the pods or the bus, do you still need to be a Metro patient, or is it open to all?
Can you read that one more time for me?
If we provide vaccines through the pod or through the bus, do you still need to be a Metro patient, or is this something that's open to all?
I think the intent, and again, I'll preface it again with, depending on the vaccine availability. I think our goal, especially as we reach out to the communities, is to, help to vaccinate communities. Metro patient, not a metro patient. Again, I think for us, it's our commitment. How do we continue to give back, to engage, with these various communities? So, all that to say, as we're doing this outreach, we want it to be more, community-based, not necessarily specific to being a metro patient, but as we're reaching out and going to places where we're meeting people where they are, we want that to be, anyone, metro patient or not.
So our next question is the vaccine recommended for children under the age of 16 at this time, and will it ever be?
At this time, no.
Okay.
Will it ever be? It probably will be, but right now, the reason it's not is, one, it wasn't tested in that age group, so we don't have data on that. And the other reason is that we know children seem to be less likely to get the virus or to pass it on or to get sick when they do. So the focus right now as a country or over the world is to vaccinate the people who are really more vulnerable and at risk, which is older people or people with conditions. So I think eventually, yes, they probably will be, and we'll know a lot more about that as we learn more about it.
Okay, thank you. How does the vaccine affect people with severe asthma?
So the major concern about asthma would be that you may have a tendency to have trouble breathing, and things may trigger that. We don't know that people with asthma, it doesn't seem like they are any more likely to develop a severe allergic reaction. But if there are concerns like that people have, we can talk about that ahead of time, and we specifically have ways that we can give people vaccine, in fact, right in our emergency room, so that we're somebody to have trouble breathing or things, we could treat them immediately. So if we know that's going on, and if you know that's going on and you're concerned, you just simply need to let your doctor or vaccination center know, and we can make accommodations to be sure that we do that safely.
That's good to know. So the age group of 16 to 64 seems quite large. Is this because there is not a higher risk of disease or mortality in any subgroup of this age range?
Well, there's no question that the highest risk of dying is in elderly people with multiple conditions. That's clearly at a younger age range in people of color, and that may be because they have more coexisting conditions or other risk factors. And Dr. Booker and I have had several conversations about that probably need to think a little bit differently in that thing about age ranges that are at risk. But the most common people to get infected right now in our county are 20 to 40-year-olds. So they're much more likely. The vast majority of cases right now are among that age group, but they're not the ones that are getting sick and dying of it. So that's, again, where we think about it as a community, is I'm vaccinating myself, and that because I care about my loved ones and the people that I might be around that might get infected.
Do we have some thoughts on why the 20 to 40-year-old group is more likely to contract it?
Oh, there's probably lots of reasons. They're at college age, out in the community, out working, maybe simply more exposure. And of course, there may be just an issue that they're not as concerned about getting sick and dying, so they're less careful about it. So lots of reasons why that's true, but it's just interesting that that's the age range that's getting the virus the most right now.
Okay. Will Metro plan on using newer vaccines that are introduced that require just one dose?
Yes, and I think that as vaccines come along and they're safe, every vaccine that we can use to vaccinate more people is going to help our whole community. some of the vaccines that are being developed aren't quite as difficult to keep safe, so they don't require this incredible cold storage. They're safer to go out into communities, so we could go out into a church or another setting and safely vaccinate people and vaccinate fewer numbers at times. So absolutely, as they become available, we're already thinking about how we logistically do that so that we're ready to use those vaccines as they become available.
Should I wear a mask after I have gotten the vaccine?
Go ahead.
Yes, absolutely. And, it's interesting. I like that question. And it takes me almost back to the question earlier around resentment towards people who don't get the vaccine. What I'm experiencing, there's perhaps resentments towards people who don't get the vaccine, resentment towards people who get the vaccine. So why did you get it? Why didn't you get it? Depending on what circles you're in. There also can be, we know and we're experiencing a lot of different thoughts around the mask. And so, a resounding yes. Everyone, please wear your mask. If you've had the vaccine or not, wear your mask.
So there's a question on here. How long should you stay on site after you receive the vaccine to make sure that you have not had a reaction?
Well, I'll get started with that. At least our current process today, we're recommending 15 minutes for the observation time. We did that as we rolled it out with the employees. We're doing the same thing as we've rolled it out to patients. And interestingly, people are relaxing, they're waiting, they want to make sure. It's been interesting, especially in the population where it's open now, the 65 and older. They're enjoying that sort of as social time. A lot of them haven't been out much or have seen so many people. We've really just used that as an opportunity to just, have some engagement, or people just have started to talk to each other and share their stories. So sometimes that 15 minutes inches in a little bit longer, but it's been it's been very interesting. But the 15 minutes is at least the minimum time frame that we're asking everyone to just wait and make sure that you're feeling okay.
I can confirm there are lots of conversations when I went to get my vaccine, and I got to meet a few new people as well. So, where can I go to learn more about the vaccine and receiving it through Metro Health?
Well, I know on our website,
Okay.
just go to Metro GR at our website, and there's a COVID information button right on the front page, and that'll take you to everything that we talked about and all the resources at Metro here. And you can find everything you need there to find anything at all that we're doing at Metro about
Right.
that.
And if I can add,
Please.
if you're like my dad and you don't go to websites, you can also call the hospital directly. And I believe that direct line is 616-252-7.
So it's 612526161, and that will take you to, that's the call center
Okay,
that
thank
we've
you.
set up. And we are, so that's where patients are being routed to schedule, but we're also asked many questions, and we are referring patients to the website or being able to answer questions. Or if we don't know the question, we'll take down their name and number, and then we'll follow up with them as well.
Okay. And that was 616-252-6161.
Correct.
So if you're not
Yes.
a website person.
Yeah.
Thank you. How do we know if the vaccine is effective against mutations?
Well, we will know that over time.
Okay.
And I've seen news articles from different things that talk about some of these variants are going to be terrible. So again, you're going to see all kinds of things. As far as we can tell right now, that most of the mutations that we expect to happen have not caused the virus to change to be more dangerous, have not caused it to avoid the vaccines that we have now. So I think that right now we're good. It's going to change over time, and we will only know that as we just follow along. That happens as the virus produces. So the fewer people that get the virus, the fewer chances that's going to happen. So these all play together. As we bring the numbers down, there'll be fewer mutated viruses, fewer chances for that to happen. So it all plays together to be one issue that we work together to bring this pandemic down.
I keep hearing that I should get the vaccine, but I can't get an appointment anywhere. Can you explain why there is such a shortage of the vaccine?
Well, I'm going to take the first part, just about the appointments. It's been interesting, and again, we don't have a lot of like background. We're learning and growing and expanding into this. But again, I think as we've talked about a little bit earlier, it's a week-to-week process of knowing how much vaccine we're receiving compared to how many appointments we can actually open. So some of the challenge in, I think Wednesdays is sort of our day. Wednesday afternoons is when there's a meeting in the morning, with Pete Haberkamp and Lori and the team to say, okay, here's what we've got. We can open up a certain number of appointments. And by the time, the appointments are open, between my chart, people calling the call center, they're taken very quickly. So we recognize that it is a challenge right now, if you're trying to call and schedule an appointment. Again, as more vaccine becomes available, more appointments get opened up. As we sort of take our show on the road, if you will, with the ABC bus or the care pod opportunities, if we're able to have, either, a walk-up or something that's, a little bit more monitored scheduling, if you will. I mean, we're looking at all of those options. But again, the rate limiter, again, is just the vaccine availability.
Okay. I wonder if there are any other questions that you received that we haven't talked about today, or any myths out there that we haven't covered that we'd like to highlight.
There's one that I heard Dr. DeHart share that I would just love to have reiterated, that has been brought directly to me, and I've seen it across social media, and that's this myth that people are dying from the vaccine. So I just want, if you could just reiterate that is not the case.
So yes, that just to say there is a lot we don't know about this virus. There's a lot we don't know about vaccines. I mean, if somebody tells you they know everything, they're lying. But there is a lot that we do know. I can tell you without question, nobody's died of this vaccine so far. Millions and millions of doses over the world. No one has died. You cannot get the virus from this vaccine. It's simply not possible. This is a fragment of the virus. It's not possible to get it. So those myths are out there, and they're simply not true. Those are the major ones I've heard. Any others? One other phenomena that I think is just interesting, and I don't know why this is, but when you look at vaccine hesitancy, which is improving, if you look at the information, people who said there's no way I'll get the vaccine, or I'm really going to wait till a lot of people get it, those are getting a lot better, those numbers. And that makes sense. People have seen millions of people get the vaccine, so they're becoming more comfortable with it. But the age group around in African Americans who are most hesitant are actually 20, 30, 40-year-olds. Older Black Americans seem to be more comfortable with it. And so that's just something we'll need to address as we go along too, is why that is, and how do we answer those questions and what the hesitancy is.
Yeah, I would just add
Yes.
one other myth that I hear, and I know Dr. DeHart spoke to this earlier also, is just misperceptions around the diversity of participants in the clinical trials. So I'm glad you spoke to earlier that people of color were a part of those trials, because people want to know that those trials included people who look like them, who lived experience may be similar to their own.
So I do have another question that just popped in. Would just one dose be effective of the current vaccines where you have to have 2 doses?
there is some effect. They certainly do have an effect. People are less likely to get it after the first vaccine. I think that the likelihood of it lasting for a long period of time is much less if you only got one dose. So what you're really looking for is a long-lasting immunity from the vaccine. But as a community, as people get that first dose, we're going to have less people become infected because after a week or 10 days, you start to develop an immune response. It's not as big as it will be after your second dose, but that does help. So yes, there is some effect of it, but I don't think it'll last as long and it won't be as strong as after the second dose.
The next question is one that I had a conversation in my household about just last night. Do you think the day will come where we will no longer have to wear masks? It's a tough question.
It is. And I think that's a decision that we'll just make as a community when enough people are vaccinated and the number of people who are really vulnerable go down. I think there will be situations where we're going to say, okay, we're safe now. So I think what each of us will have to decide is if there are people in our lives who are particularly vulnerable, and that is not going to go away. So we'll have to be thinking about our parents and our grandparents or people who are ill around us. And I don't think that will ever go away about thinking about being thoughtful about how we protect them. But I do think the day's coming before very long where we'll be able to go out in public and not be so worried about that, perhaps be in groups of people. First of all, family, and then larger groups without masks. Maybe in a year, that's a guesstimate.
Okay, thank you. Are the clinical trials in children coming soon? Curious to know when that vaccine will be available to them.
And to be honest with you, I simply don't know.
Okay. Okay.
That's probably knowable, I just don't know the answer.
All right, so if there are no other questions, I want to make sure that we encourage those that are watching to visit the metrohealth.net or call 252-6161 for any additional questions. I want to say thank you to Metro Health, University of Michigan Health, for hosting today's community conversation, and a special thank you to our panelists today, Dr. Del Hart, Dr. Booker, Monica Taylor, and Dr. Henry, who had to step out. She is a practicing surgeon, so we let her do what she does best. I hope that there was some clarity provided today in the hesitation surrounding the vaccine, and hoping that with the clarity it provides, creating a healthier community. So I hope that you all stay safe, and thank you.